Hi, I'm Dr. Paul Ruff at West End Plastic Surgery, and I'm here with one of our nurses, Christy McHale, and today we're going to talk about IPL, Intense Pulse Light. It's an acronym because everything has to be an acronym these days. Intense Pulse Light is probably one of the broadest and best treatments. There's almost nobody who couldn't benefit from Intense Pulse Light. It is applicable to a wide range of skin treatments and really is a tremendous benefit, not only as a primary treatment, but even for scar management. So, Christy, tell me about who you think is the best candidate for IPL.
So the things that I like using for the IPL, the Intense Pulse Light helps with brown pigmentation. It's attracted to the pigmentation cells. It's attracted to the red vasculature. And you also get collagen stimulation. So people who are wanting more of an even skin tone or have a lot of redness through the middle section or a lot of sun damage, those are the candidates that I find are the happy with the treatment.
And when you're discussing treatment options with a patient, how many treatments do you usually find gets a patient to their best?
So we do recommend a series of treatments typically. I say typically anywhere between 3 to 4 treatments spread about a month apart from each other because you want to give your skin some time to stimulate the collagen. So about 3 to 4 treatments. It depends on what your goals are or what conditions you're trying to treat.
Yeah, and I find when I've had my IPL treatments, I feel like my skin it definitely looks a little irritated coming out of the treatment. But there's no downtime to it.
Yeah, so there's no downtime. Any little brown spots you have kind of darken up. The thing I really like about the IPL is you can, for women and some men, you can put on makeup right away. So you look a little bit red if there's vasculature. The browns tend to darken up a little bit, but the entire time you can slap on as much makeup as you want right away. So there's really no downtime to the treatment. Some people afterwards, even with a little bit of that irritation, because it's almost a little bit of swelling that's stimulating the collagen, they actually like the way they look because it gives them a nice, they call it a glow. I've had some clients be stopped in the street and say, your skin looks amazing because it gives them a glow about them. So it is a really nice treatment for DC particularly, where people are so busy with work and can't allow for a lot of downtime some of the times. And it's good for maintenance in between surgical procedures, or there's not one thing that quick fixes, it's a combination of things. So for people who aren't really addressing serious issues or really wanting a whole lot of improvement, even spacing it out, some people recommend it once a quarter just for kind of a general maintenance if you're on more of a maintenance plan. Some people will do it more aggressively before a wedding event, social engagement, to kind of get their skin looking good for a specific event. So then we'll stack it monthly a little bit closer towards that event.
Yeah, and that is what I like. It's very tunable, not only to the issue from whether it's a red issue, a brown issue, a combination. It can be used literally all over the body. I mean, we've used it legs, feet, hands. Our facial rejuvenation patients, we're typically including their hands just because you don't want that giveaway. In the fact that it is really no downtime. I mean, your skin may look a little irritable. If you get that glow, fantastic. That is great. But there's really no downtime, and it can be used in combination with other things like injectables. There are times when I've actually chemical peeled right after my IPL, like a Jessner's peel, to help facilitate some of that turnover. It makes it much nicer.
I also like it for some of my clients on the neck. A lot of people have this lateral, I saw a little bit, that's why it cued me in, lateral damage from the sun. A lot of us on the driving side, if we do a lot of driving, it looks asymmetrical to the other side. A lot of my clients also use it down the décolleté area for women if we're showing, a little bit more of this area, because we do tend to get sun damage from wearing lower cut things over the years. Some people, stimulating with some sleep lines if they're pretty superficial to help stimulate some collagen in that area helps as well.
Fantastic. So we have a couple of machines here, our Luminous M22 and my Cutera. The Cutera has a 560 nanometer filter, and we have a number of different filters on the Luminous platform in order to really be specific about the treatments that we're targeting. So thank you for talking with me today. So I'm Dr. Paul Ruff with Christy McHale, If you're interested in IPL, don't hesitate to contact our office, 202-785-4187, and through our website, www.westendplasticsurgery.com. We have a number of practitioners who perform IPL within the practice. Christy does, Lori, Nora, our other nurses, as well as our medical estheticians. So if your schedule is needs a particular timeline, or you just gel with a particular provider, we have somebody for you. So thank you for taking the time with us today.